Prostate. It's one of the most important glands in males, and you should know about these zones and lobes. Anterior lobe or isthmus is roughly corresponds to part of transitional zone. Posterior lobe is roughly corresponds to peripheral zone. Right and left lateral lobes span all zones of prostate, and median lobe or middle lobe is situated there. The prostate is an exocrine gland of the male reproductive system. Looks like walnut, 7 to 16 grams. Literally, this gland is one who stands before protector guardian. The function of the prostate is to secrete a fluid which contributes to the volume of the semen. This prostatic fluid is slightly alkaline, milky or white in appearance. You should remember about such zones as central, prostatic urethra, peripheral zone, transitional zone, a fibromuscular zone, and this one is penile urethra. About seminal vesicles you should know actually from anatomy. Here you can see the connection between the urinary bladder and prostate. The apex of this organ of the prostate is on the pouch of peritoneal muscles. Actually, you can see verumentanum, as I said before, air-collar ducts, and sphincter muscles. The bladder neck is connected to base of prostate. Here you can see some zones of this organ: peripheral, transitional, central, etc. And of course, urethra. Now, something about common symptoms in urology. Every doctor should know that pain, urinary disorders, quantitative changes in urine or qualitative changes, pathological discharge from the urethra and changes in sperm and external genitals also in men are very important in our science. Early signs of kidney stones, for example, are listed here. It may be pain in the back, belly or side, nausea, vomiting, pink, red or brown colored urine, feeling the need of pee often, only being able to pee a bit, burning or pain while you pee, fever and chills, and cloudy or smelty urine are important to remember. One of the most important signs of urological disease is a renal colic. Here you can see location of this renal colic according to connection with nerves. Kidney pain, it's tenderness or at a costovertebral angle, and pain of ureteric colic. Here you can see the travel of this pain. Gastrointestinal symptoms may occur due to reflex irritation of the solar plexus. Along the urinary tract through the iliac region to the genitals, it may appear in different people, males, females also. Restless position. Patient rushes on walls, can not find the position, is in a pain. It's a real sign that you should note while you are seeing a patient. Intensity does not depend on the position of the body, changes paroxysmally. Lower back pain during urination is a typical symptom of vesico-ureteral reflux. Remember this disease. And here you can see these symptoms collectively. Differential diagnostics includes different branches of medicine. You should be well known in different parts of human organism, and these diseases such as peptic ulcer disease, pancreatitis, splenic infarct or injury according to location of left kidney, diverticulitis, ureteric colic, ectopic pregnancy, ovarian cyst. For example, if the kidney stone is located in the distal part of ureter, acute cholecystitis, cholangitis, biliary colic, appendicitis, of course, and other diseases. And now about bladder pain. Localization. It's a suprapubic region behind the pubis in the depths of the small pelvis. For example, it may be urinary retention or cancer. According to this, patient can have intolerable pulling pain because of overstretching of this organ. Inflammation. It may be bacterial or interstitial cystitis. Inflammation of bladder walls. It's a dull, aching pain that occurs and grows with the accumulation of urine when increases sharply during urination. Here you can see in this picture inflamed bladder. And bladder calculi, of course, stones of this organ. This big one is awesome, really, and its stitching, cutting pain occurs when moving and subsides at rest. Urethral pain, of course, it may be urethritis in different pathogenesis, for example, chlamydiosis. It's acute and chronic, maybe acute and chronic, passage of calculi, of course. It's a high content of salts, oxalates, phosphates, urates in the urine, and patient can have burning and pain during the passage of urine. For example, it can be also infiltrating urethral cancer. It may be dull, aching pain along the urethra that is not associated with the act of urination, most commonly in men. Here you can see some schemes of inflammation due to Trichomonas vaginalis. Prostate pain. Of course, this localization is in perineum, anus, and in the depths of the pelvis. Irradiation can be into the sacrum, lumbar spine, along the spermatic cord, into the testes in men. Chronic inflammation processes in prostate. The pain is low, intensive, constant, and pulling. Acute prostatitis or prostate abscess cause intense, throbbing, or shooting pain, sharply aggravated by the act of defecation. Actually, it may be prostate cancer. And prostate condition includes urinating oftenly, painful urination, blood in urine or semen, and dripping urine. Here you can see the progress of appearing the cancer of prostate. From the stage 1, the tumor of cancer cannot be felt by doctor during the rectal exam, but here you can see the locus of tumor. This second stage, the cancer can be felt, but it has not spread outside of the prostate to near organs, for example, vesica seminalis or bladder. Stage 3, the cancer has spread outside of the prostate into nearby tissues, for example, to lymph nodes. The cancer has spread into nearby organs such as the bladder. Here you can see a histological picture of these diseases. Here you can see adenocarcinoma and this locus of tumor. And penis pain. If a person has a non-erected penis and has a pain, it may be urethritis, a typical cutting pain at the beginning of the urination. It may be phimosis, the scheme of these diseases you can see here, or paraphimosis. If penis is erected, it may be pineal fracture. Here you can see the picture of this process, Peyronie's diseases. Here you can see a fibrous plaque is the cause of this disease. And priapism, for example, it's a stage of this disease. It's a blood supply of penis, and you can see a situation when it's normal erection, and it's a situation with priapism, and scalpel is needed to improve this situation and to be patient